bone. So this is going to be the process, the alveolar process of either the mandible or maxilla that's holding the tooth in place. So all this is in C2. So if we see the bone around it here, which part of the tooth is this down here? It's the root, right? So the root of the tooth is the part that's firmly attached into the bone. There is a type of ligament that you may or may not remember, a type of joint called a gymphosis. Remember that term? Probably not. That basically connects the tooth into the bone. And that's that level of detail I probably will not ask you on a final exam, because I don't even think I put on, if it wasn't important enough to make it on a midterm, it's certainly not important enough to make it on a final. But that's holding it in place. We don't really see that super well. There would be, if we looked closely, we would be able to see Sharpie's fibers connecting that tooth in. You remember those are things that connect bone, or in this case, tooth into the fibers. This central thing, what do we call that? That's the root canal, right? So this is the root. That's the root canal. Okay. And then that root canal opens up into a larger pulp cavity. Right. This tooth is a single cuspid. So it's only a 1-point tooth. This is basically, it might be, or depending on the section here, I can't tell for sure if it's an incisor or if it's one of the canine teeth. The classic tooth that's in all the pictures that you've seen is a molar, like one of these, right? So when you're looking at this model and you see the pulp cavity where there's two root canals and this larger pulp cavity, that's because it has two roots. It's one of the teeth that has two. This tooth only has one. So it's not going to look like that. This has two roots, that one has one. It's going to be a difference. But we still do see this enlargement of the root canal as it comes up to the top of the tooth. This tooth is upside down. So the top of the tooth where it enlarges out to the pulp cavity. This layer of tooth material right outside of that pulp cavity is called dentine. And then outside of that, enamel. Right? And that's actually not, that's not the enamel. The enamel is actually just on here. So this other stuff outside is not part of the tooth. Yeah. Because it should, it would not obviously come over and cover the gums. Right? So your mouth is not coated with enamel everywhere. Right? So that is probably just part of the preparation that they used. This layer in here is going to be the enamel layer of this tooth, which should kind of come down and disappear out a little bit. So maybe, I'm guessing that this might, I'm not sure whose tooth this is. It's clearly erupted already, so I was wondering if it's like an fetal tooth before it's erupted, but it's clearly erupted because there's the gum. So the enamel layer is not quite as clear and distinct as you see in some of the pictures. You want to shed any light on this for us?
I usually look at X-rays, not microscopes.
Yeah, got it. Okay. With that said, I think now that's everything on the histology. So we have about 20 minutes left to work on whatever you need to work on.